And now I would like to welcome Christina Fialho. Christina is the co-founder and executive director of Community Initiatives for Visiting Immigrants in Confinement, otherwise known as CIVIC. She's an attorney, a 2012 Echoing Green Fellow, a 2016 Ashoka Fellow, and currently a social entrepreneur in residence at UC San Diego's Rady School of Management. CIVIC is a national nonprofit that is working to end the U.S. immigration detention system. CIVIC currently visits and monitors 43 of the largest immigration detention facilities on a weekly basis through a network of volunteers. You can also learn more about CIVIC at endisolation.org. And if I may add, I must say that I've known Christina for many years. She and I hail from the same alma mater, and I was actually her first intern, so I'm really thrilled to have her now as a colleague. And with that, welcome, Christina.
So I want to start off with sharing a story. Latoya Ricketts is a transgender woman who was detained at the Santa Ana City Jail in the summer of 2016. And she had just visited with her attorney and was being escorted back to her jail cell by a corrections officer at this facility. Thank you. She was being escorted back to her jail cell by this corrections officer who is a male. She's a transgender woman. And this corrections officer told her to go into the men's restroom. And inside the men's restroom, the corrections officer told her that he was going to have to perform a strip search. And what he did is he said that she needed to take off her clothes slowly and lustfully. And Latoya was humiliated. This happened 6 months after CIVIC filed a complaint with the Office for Civil Rights and Civil Liberties at DHS that was on behalf of 31 transgender and cisgender women who were victims of routine, unlawful, and degrading strip searches at this exact facility. But our complaint had gone uninvestigated, like so many complaints, and therefore sexual assault continued at this facility. So as Claudia mentioned, CIVIC, or Community Initiatives for Visiting Immigrants in Confinement, is a national nonprofit, and we're working to end the U.S. immigration detention system. We visit and monitor 43 of the largest immigration detention facilities in the country through a network of volunteer-run visitation programs. We also run a national hotline that allows people to call us at no cost to them. And through these two windows into the immigration detention system, we're able to track human and civil rights violations such as medical abuse and sexual assault. So in early 2016, we began to see an increase in the number of complaints being lodged with us about sexual assault from both transgender immigrants as well as cisgender immigrants in detention. And we decided to see if the government's data was reflecting the same increase. So we filed Freedom of Information Act requests with 3 agencies within the Department of Homeland Security: ICE, which is Immigration and Customs Enforcement; OIG, which is the Office of the Inspector General; and the Office for Civil Rights and Civil Liberties. We gave ICE and the Civil Rights Division nearly a year to respond to our FOIA requests. We followed up with them on a monthly, sometimes weekly basis, and they chose not to comply with the Freedom of Information Act. The Office of the Inspector General, they responded within a prompt time, and the data that they provided us was extremely disturbing. What we learned is that between January 2010 and July 2016, there were over 33,000 complaints of sexual assault or physical abuse being lodged with the Office of the Inspector General against DHS component agencies. And ICE had the largest number of complaints. There were 44% of the complaints were against ICE, which is about 15,000 complaints. And CBP, Customs and Border Protection, which also runs immigration detention facilities at ports of entry, they received 10,000 of the complaints. Now, out of over these 33,000 complaints, OIG investigated less than 1% of these complaints. They investigated only 247 complaints. So this is extremely disturbing because immigrants who have been sexually assaulted in immigration detention are re-victimized by an ineffective or non-existent investigation process. And by not properly investigating sexual assault, our government and all of us are sending a message that sexual assault of immigrants will be tolerated, and this is wrong. So sexual assaults are being perpetrated by ICE officers, by contracted facility guards, and even by medical professionals. So one woman that we interviewed, Roslana Santos, she was detained at the York County Jail in Pennsylvania, and she was being escorted back from an immigration hearing to her jail cell. And another male officer at this facility told her that she needed to go into this other room. This room had no cameras. And he told her that she needed to do everything he said or else he would sodomize her. So she was brave and she filed a complaint. Most people do not file complaints. Only 18% of the people who tell us about sexual assault actually go forward in submitting a complaint to the government. So Roslana filed a complaint. But instead of investigating this complaint and addressing the issue at hand, they threw Roslana into solitary confinement for 11 days. There's other really disturbing cases. So for example, at the Northwest Detention Center, which is a privately run immigration detention facility by GEO Group in Washington State, a man filed a complaint about sexual assault during a medical examination by Immigration Health Service Corps, which is a branch of the government that oversees healthcare and actually provides healthcare at this facility. And this isn't just happening to adults, this is happening to children. So at the Carnes Detention Facility in Texas, which is a privately run detention facility, there was a young girl under 18. She was there with her mother because this is a family immigration detention facility, and she was sexually assaulted. And she filed a complaint. She was provided with a medical examination. The medical examination found vaginal scarring and an STD, but ICE and DHS deemed the complaint unfounded. And many of the complaints and the individuals that we spoke to, like a gentleman, Douglas Menjivar, who was raped in immigration detention in Texas, his complaint was not addressed till 3 years later. He wasn't given a rape kit, so there was no evidence, and the witnesses to the rape had already been deported by the time his case was investigated. So of course, DHS found that his complaint was unsubstantiated as well. So I'm here today because I want to ask Congress to do two things. So one, we want Congress hopefully to create the second bipartisan National Prison Rape Elimination Commission. The first bipartisan Prison Rape Elimination Commission actually put out a report in 2009 that found a large and growing number of detained immigrants are at risk of sexual abuse. The second thing that we want to see happen is for DHS to publish sexual assault complaints and investigations on a quarterly basis. The Freedom of Information Act exists for a reason, so that the public can know what's happening behind closed doors with our tax dollars. But DHS consistently undermines the integrity of FOIA, and we need to know what's happening with regards particularly to sexual assault. And so after this congressional briefing, Congressman Grijalva's office will be following up with congressional offices with a sign-on letter really asking for these couple things and really highlighting the problems with sexual assault and immigration detention. I want to leave with just a quick note about why I got involved in this work. So I got involved in this work because I could no longer bear to see mothers being ripped away from their children. I could no longer bear to see communities being torn apart. And I come from 3 generations of immigrants. My great-grandfather came here through the Azorian Refugee Act, and my grandparents and my dad followed. And Congress in 1958 created the Azorian Refugee Act, and that not only affected my great-grandfather, that affected generations to come. So what Congress does today and what we all do together today not only affects people in immigration detention and their families right now, it's going to affect generations to come. So I hope you'll join me in working to abolish sexual assaults in immigration detention. Thank you.
Thank you. And aren't we lucky that Congress did that act years ago so that we could have Christina speak in today?